What are the differences between dystrophic calcification and metastatic calcification? Dystrophic calcification, it is the deposition of calcium in the dead and degenerated tissue. Metastatic calcification is the deposition of calcium in normal tissue. D for dystrophic, D for dead and degenerated. And metastatic is the deposition of calcium in normal tissues. Calcium metabolism is normal here, and here it is deranged. Calcium metabolism is deranged in case of metastatic calcification. Serum calcium level normal, and here high. Calcium metabolism is deranged, calcium levels are high in metastatic calcification. Extends, dystrophic calcification tends to be localized, metastatic is widespread or diffuse. Extent of location, dystrophic is localized, metastatic is widespread or diffuse. Pathogenesis, calcium is deposited in the necrotic tissue, dead or degenerated tissue, necrotic, dead or degenerated tissues. Metastatic calcification, high blood calcium and high pH favor tissue mineralization. High calcium levels and high pH favors tissue mineralization. Causes of dystrophic calcification. Dystrophic calcification is seen in necrosis, atherosclerosis, Monckeberg medial calcification, dead parasites, tumors like papillary cancers of the thyroid, ovary, salivary gland, and Crest syndrome. Metastatic calcification is seen in hyperparathyroidism, osteolytic lesions like multiple myeloma, M for metastatic, M for multiple myeloma, and milk alkali syndrome. So, metastatic calcification is seen in osteolytic lesions, example multiple myeloma, then milk alkali syndrome, and hyperparathyroidism. Hyperparathyroidism, osteolytic lesion, example multiple myeloma, and milk alkali syndrome. Dystrophic calcification is seen with necrosis, Mockenberg medial calcification, atherosclerosis, dead parasite tumors, papillary cancers of thyroid, ovary, salivary gland, and Crest syndrome. Dystrophic calcification is seen in necrosis, atherosclerosis, Mockenberg medial classification, dead parasites, tumors, example papillary cancers of thyroid, ovary and salivary gland. इसमें डिस्ट्रॉफिक कैल्सिफिकेशन मिलता है. एट्रोफिक एथेरोस्क्लेरोसिस में मॉकनबर्ग मीडियल कैल्सिफिकेशन में डेड पैरासाइट्स के केस में क्रेस्ट सिंड्रोम में डिस्ट्रॉफिक कैल्सिफिकेशन मिलता है. मल्टीपल माइलोमा मिल्क एल्कली सिंड्रोम, हाइपरपैराथायरॉयडिज्म में metastatic calcification. Samoma bodies are seen in dystrophic calcification. Samoma bodies are concentric rings of calcium deposition. These are the Samoma bodies. These are concentric rings of calcium deposition. These are seen in papillary carcinoma of thyroid. Okay. Dystrophic calcification, necrosis, atherosclerosis, Mockenberg medial calcification, dead parasite tumors like papillary carcinoma of thyroid, ovary, salivary gland, Crest syndrome के केस में दिखता है. Metastatic calcification में Samoma bodies are not seen. Stain for calcium is von Cosa. Von Cosa is the stain for calcium. So dystrophic और metastatic के बीच के डिफरेंसेस का पॉइंट क्या है? डेफिनेशन. डिस्ट्रॉफिक डेड या डीरेंज्ड टिश्यू में, मेटास्टेटिक नॉर्मल टिश्यू में. कैल्शियम मेटाबॉलिज्म नॉर्मल, डीरेंज्ड. सीरम कैल्शियम लेवल्स नॉर्मल, हाई. एक्सटेंट लोकलाइज्ड, वाइड स्प्रेड या डिफ्यूज. पैथोजेनेसिस द डिपोजिशन ऑफ कैल्शियम इन नेक्रोटिक टिश्यू. Here the high blood calcium and high pH favors tissue mineralization. Causes of Dystrophic necrosis, atherosclerosis, Monkey-Borg, medial calcification, tumors like papillary cancers of thyroid, ovary, salivary gland, CREST syndrome. Metastatic calcification causes hyperparathyroidism, multiple myeloma, milk alkali syndrome. Samoma body are seen in dystrophic calcification and not in metastatic calcification.